1 month before children return to school, COVID-19 cases and hospitalizations continue to rise in Utah and across the country. Pediatricians from University of Utah Health and Intermountain Healthcare today urged parents to get eligible kids vaccinated, even if they haven't already.
And as news specialist Jed Bull shows us, more than a third of those students are ahead of the curve.
Most Utah school kids head back to the classroom in 5 weeks. Pediatricians are urging eligible students to get vaccinated soon because it takes 5 weeks to be fully vaccinated.
We're seeing a very significant surge in disease.
Kids 12 to 18 should get vaccinated.
The picture this fall is going to be very different than we thought it might be when things were looking better. And there's going to be a lot of concerns about transmission in school.
Nearly half of Utah's counties are rated high transmission for COVID-19, the most since early March, encouraging hesitant parents to talk with their family physicians.
They do tend to trust their primary care physicians, so I would encourage you to go out and make appointments, or talk during your well-child exams about not only vaccinating your children, but yourselves.
So far, 38% of Utah children 12 to 18 have had their first dose, ahead of most states.
That shows the enthusiasm that many parents have had for protecting their kids. But 38% is not nearly enough. We've got a long way to go.
For kids under 12, the FDA says vaccinations may not come until midwinter. With the recent surge in cases, these pediatricians would like to see kids under 12 wear masks when they're indoors.
It's really concerning. I mean, I think especially when we have a vulnerable population under 12 that can't be vaccinated. I mean, I personally would like to see kids wearing masks in school, especially in that age group.
Utah lawmakers banned face mask requirements in schools. Schools and teachers can still encourage students to wear masks, but they cannot mandate it. Masks can still be required by schools in collaboration with local health departments during outbreaks.
More of the cases that are being diagnosed around Utah are in people 15 to 45. More of the hospitalizations are occurring in that age group. So there's a lot of benefit to getting vaccinated.
The CDC also encouraging vaccination to enable in-person learning this fall. For KSL 5 News, I'm Jed Bull.